So let's just shift gears quickly here and talk about, well, what are the consequences? So what? Patients are non-adherent. What are the consequences of non-adherence to breast cancer therapy? And in the question that we asked initially, certainly everybody seemed to agree that there were consequences, but we'll just take a closer look at this quickly. This is one of the quotes. I was thinking, you've already been taking this medication for 2 years and everything is fine. I didn't see why I couldn't stop taking the medicine. Well, we know that without estrogen, tumor growth is inhibited. We can stop estrogen production, and this is a good way of explaining it to patients. We can stop estrogen production by taking these drugs, and when the medicine is stopped, the estrogen will be produced again. After menopause, I felt my body would take the estrogen away without having to take any medication. Well, I think it needs to be explained to patients that this isn't the case because there are ways that the body produces even small amounts of estrogen through the aromatase enzyme even after the ovaries have shut down. And I think a lot of patients maybe don't understand this concept. I felt that I took it for more than 3 years and it must have done its job. Well, we know that a lot of the data that's out there shows that there's a benefit for taking these medications out to 5 years. And I think that it behooves us to try and make sure that patients are fully understanding of this fact, that it's not going to work as well if we don't take it for the period that it's prescribed for. The benefit is only maintained if patients stay on the medication. And patients know radiation and chemo will help, but sometimes they don't seem to attribute similar benefits to the hormonal treatments. And why this is a good question. Perhaps it's because it could be because of the side effects. Patients seem to associate sometimes more efficacy with more side effects. But we certainly know from the ATAC trial, which we have long follow-up from, that there is a consistent and continued benefit out to
ATAC.
Out to 12 years now. That is quite substantial for patients.
Actually, you know what? I'm not sure it is ATAC.
I can hear somebody on the line there. That is a curve from the ATAC trial, if you're wondering. So how does non-adherence affect treatment outcomes? This is the question. So in much of the literature, the definition, and this is arbitrary, but optimal adherence is defined as taking 80% of the prescribed doses correctly. And there certainly is mounting evidence that there is an impact on progression-free survival and possibly overall survival in patients who don't take their treatment optimally. So let's just look at some numbers here. So this is some reports of outcome impact in the literature. Patients who took tamoxifen for less than 1 year had a substantially higher mortality rate than those receiving it for 5 years or more, and you can see the hazard ratio there is quite high, 6 times more likely to die. There was a cohort study done in the UK, published in the British Journal of Cancer, that showed that adherence to tamoxifen of less than 80% was associated with poorer survival, and it was statistically significant. And as well, in a Dutch observational study, there was poor adherence was associated with a lower event-free time. So there was and this was in the metastatic population, but patients recurred quicker.